Hello, my name is Elise Branson, and I am covering non-coercive paraphilias. What are non-coercive paraphilias? Well, to understand that, you first have to understand the word paraphilia, which is a mental disorder characterized by the American Psychiatric Association as recurrent, intense, sexually arousing behavior lasting at least 6 months and involving non-human objects, the suffering or humiliation of oneself or one's partner, or children or other non-consenting persons. Non-coercive paraphilia is defined as harmless and victimless paraphilia, sexual behavior. Examples of this are fetishism, partialism, transvestism, sadism, and masochism, which we are going to explore over these next few slides. Just for a quick overview, we are going to define and understand variations of non-coercive paraphilia, look at the origins of each of these disorders, and the potential treatment options. But first, I want you guys to meet Nathaniel, a 28-year-old man who has an unusual fetish.
Nathaniel asked me to come up here. Basically, he had something that he wanted to tell me. I don't know exactly what it's about, but I'd like to know what's going on in his life.
Yeah, it's something pretty important I want to talk to you about.
All right.
I'm just gonna come out and say it, I guess. I'm in an intimate relationship with Chase, sexually and emotionally.
You're in an intimate relationship with your car.
Yes.
And sexually with your car.
Yes.
It's your car.
Yes.
How does that work? How can you have sex with a car?
Mainly, it's just a lot of just rubbing up against him.
Okay.
And it involves masturbating as well.
Fetishism is a paraphilia involving sexual arousal from an object. This object can be inanimate, like sex toys, a car, or underwear, or it can be a body part. I'm sure most of you out there could attest that some people claim to be a boob guy or a butt guy, and ladies might say they prefer abs over arms. In a way, these are slight fetishes, but for a true fetishist, it is hard to achieve arousal when their fetish is not present. Possible reasons for fetishism are sexual imprinting, classical conditioning, the growing social norms and acceptance of fetishism, and neurological differences. Partialism is the exclusive attraction to a specific body part. In these situations, the person focuses on or is more dependent on the presence of a non-genital body part to get sexually aroused. Some of the more common forms of partialism surrounds breasts, legs, feet, hair, ears, and toes. Partialists enjoy licking, stroking, caressing, and touching the body part. Possible origins include classical conditioning and cognitive distortion. Transvestism, also known as cross-dressing, involves wearing clothing of the opposite sex for any reason. It is sometimes sexual and sometimes for other reasons. It is imperative to distinguish the difference between cross-dressing and drag. Drag is typically done by men who cross-dress and perform. Transvestism is done for sexual excitement or for humorous reasons. It is important to note that when women cross-dress, it is seen as okay because we live in such a patriarchal society. People think she is empowering herself by dressing like the more dominant sex. However, if a man wears a dress, he is a transvestite, which sadly comes with negative connotations. It is hard to say why sexual arousal comes from cross-dressing, but some people think it is a way to subvert oppressive gender roles, a way to express both masculine and feminine sides, and can help people feel more comfortable in their bodies. Also known as S&M, sadism and masochism are elaborate acts of simulating consensual, dominant, and submissive behaviors. The sadist enjoys dominating, and the masochist enjoys being dominated. They become paraphilias if the acts are not simulated and cause true physical and psychological pain. Oftentimes, S&M are accompanied by other paraphilias like fetishism, transvestism, bondage, and more. Possible origins include Freud's ideas on the connection between aggression and sexuality, imprinting and childhood experiences, and brain or endocrine abnormalities. Treatment for non-coercive paraphilias are typically not desired or needed by most fetishists. Many of the practices are personal choices that are private and perfectly okay to engage in. However, if the fetish is causing psychological or physical harm and is impairing social, occupational, or other essential functions, I would advise that you seek help. Cognitive behavior therapy, sometimes mixed with pharmaceutical regimens, can help those who need it. In extreme and very violent cases where other procedures did not work, surgical castration and stereotactic neurosurgery have been known to take place. I'd like to finish with saying that everyone has the right to explore sexuality and love with their partner however they see fit. if it is consensual and involving healthy practices. I think Dr. Seuss sums it up with we are all a little weird and life's a little weird, and when we find someone whose weirdness is compatible with ours, we join up with them and fall in mutual weirdness and call it love. Thank you for watching.